So in this session, I'm going to go over foot detoxification. There's heavy metals all around us, and certainly during this time of year when we struggle with colds and sicknesses, a lot of it is because of um, a toxic buildup in our bodies. And the question is, what tools are out there to help us get rid of this toxic load? So one way to get rid of the toxic load in our bodies is to use the ionic foot bath. I'm sure many of you have seen this technology used in different naturopathic clinics or chiropractic clinics. So what happens is you place your feet in warm saline solution, then you put an electrode, a silver electrode with an anode and a cathode in the water, and as you sit there, you hear it bubbling, and after about 30 minutes, you see the sludge coming to the surface. So let's talk a little bit about the theory behind it, then we'll get a little bit more into the practical aspects of it. So what happens is as the current passes through the water, uh, H2O, hydrogen is released, and negatively charged oxygen atoms are formed, and then they enter the pores of your feet. And the pores of your feet are the largest pores in your body, in your feet, in your armpits, in your groin area. What happens as these negatively charged electrons enter your body, they attach to uh, the heavy metals, which are positively charged, parasites, which are positively charged, and any other germ. And so then it assists the body in recognizing these pathogens or these heavy metals or these toxins and allow you to excrete these toxins. Now, a lot of times what you're told is that the sludge that's on the surface is the toxicity, the toxins coming out of your body and entering the water. So we'll talk a little bit more about that, but that's the theory, a bit of the theory behind it. So when you see the sludge, you may be a little worried, maybe a little disconcerted. The question is, what is the sludge? Is the sludge actually junk or germs or parasites coming out of your body, out of your pores and into the water? I don't believe that's the case. So the sludge that you see is is essentially rust. So the or the silver anode and cathode interacting with the water and yep, forming a sort of like a rust that floats on the surface. So what we really want is for the electrons to enter the body and assist with the detoxification. But this sludge isn't necessarily coming directly from your body. So some people will say, some practitioners will say that you can see this chart here. If it's thick, if it's black, then you'd think heavy metals. If it's a brown texture or a look, then you're going to think liver is detoxifying. If it's a dark green, then you're thinking gallbladder. If there's an orange, you're thinking the joints are there's detoxification coming out of the joints. And you can read the chart for itself. I don't know how accurate this is, but this is a chart that a lot of practitioners will use. So this is just so you get an idea of um, what what to expect. You place your feet in the water after about 15 minutes. It turns dark. After 30 minutes, the layer of like rust that's coming off of the anode and the cathode comes to the surface, and it's very thick. And typically they put bags or sleeves in the bucket so it doesn't stain the plastic. So let's talk a little bit about the research that they've done. So the research I've looked at on PubMed is not very complimentary. So what they've done is they take multiple people, patients, put them through the foot detoxification protocol, And then they would check their blood labs, and they would also check the water itself to see if there are any heavy metals or parasites or any germs that are actually coming out of the skin. So according to the research, they really didn't find anything in the water, so they didn't see any toxins or finding toxins actually leaving the person's body and entering the water. And secondly, when they did the blood labs before and after, they really didn't see much of a change or any change in the patients. So according to the research, there's really nothing to talk about. Now, my interest typically when I look at medicine is clinically, does it work? Clinically, what happens to the patient's symptoms? So I talked to an AK doctor who retired a couple of years ago, and it was common for him to put patients who are going through chemotherapy. He'd put them on he'd have them do these ionic foot baths. And as long as they were doing these ionic foot baths, these patients, they wouldn't lose their hair, they wouldn't lose weight, and they remained extremely healthy. And as soon as they went off the ionic foot baths, they would lose their hair, and they would lose weight, and they become very sick. And for myself, I've placed patients on the ionic foot baths, and they've responded very well. They'd feel more healthy. A lot of their symptoms or aches, their pains would go away. And even myself, even a couple of weeks ago, I had some really severe lower back pain. I couldn't figure it out. I went to other doctors and other natural doctors. I even treated myself. I just couldn't figure out what it was. And so finally, I just used my own ionic foot bath. And after a few sessions, and along with an acupuncture treatment, the pain went away. So I believe there's a high degree of toxic load in my body, and the ionic foot bath helped remedy that. So the question is it safe? So it is safe. There's a couple of people I would not recommend using it. It would be pregnant patients, patients that have severe kidney problems because then you're not going to be able to detoxify well. Patients are on a blood thinner, or even patients who may be allergic to any of the extra ingredients, maybe or items maybe putting in the foot bath. But other than that, it's extremely safe. And for people who want to purchase their own, Amazon has a good selection. I mean, I don't really recommend any specific brand per se. Just look at the reviews, you'll find a good one. Typically, a good one will go for about $100. So if you want, I know it's the Christmas season. If you want to buy one a for a friend or a loved one, someone who has a toxic load or has some health problems, I would highly recommend this. I mean, I'm sure they'll respond well to it. But you can get one for about $100 in Amazon. So in conclusion, do I recommend this? I do. I haven't seen huge results, but it really depends on what the problem is. If a patient is dealing with a high toxic load, then this is really gonna be wonderful. If they're dealing with parasites or other sort of infections, it will help, but it's not the solution. So more just for patients who are really dealing with a heavy toxic load or even diabetic patients, this is really going to help with healing. It's going to uh, give a person more energy, more clarity. So I definitely recommend this. So I hope you found this helpful. It was just a brief overview of foot detoxification. And again, foot detoxification, I know it can be controversial, but in my practice and other practices, I've seen that it's been very effective at reversing patients' negative symptoms.